This is health reform policy is really an exciting implementation of a policy that we've been waiting to happen for years. And it's finally happening now. And it's something that is so critically important to grassroots organizations that serve underserved communities. And so it's really important for these grassroots organizations to really understand what is happening with health reform. Get familiar with the language, get familiar with the players, get familiar with the potential partners. All of that is incredibly important because they're going to be important to the successful not only implementation, but access to health insurance, which so many families need. So I'm really excited about them being a part of this.
So tell me, what is health reform all about?
Well, first of all, health reform came into being in March of 2010. President Obama signed the law that said essentially that it expands access to health insurance to all Americans. That means that all Americans now, it's the law, must have health insurance by 2014. And then it goes on to tell in great detail what the time periods are for all of the different components. In saying that everyone must have health insurance, it's a lot like, just compare it to auto insurance. We know in California, if you own a car, you must have insurance. It's the law. If not, there are penalties. The same will apply with health insurance, as we know it as of right now. The implementation of health insurance is going to be facilitated, and this is what the law says, that every state who is going to be providing health insurance, and we're all required to do it, must set up a health benefit exchange. So health benefit exchange is really what grassroots organizations should really be paying attention to. What is the state health benefit exchange doing in my state? I think it's also important to know what has taken effect with the current health reform. And I also want to talk a little bit about, it's the Patient Protection and Affordable Care Act. That's the long name. The acronym that's used is ACA, Affordable Care Act. So folks in the grassroots communities should definitely be familiar with ACA, with that acronym. Get really comfortable and familiar. Anytime you hear something about that, pay attention to what's happening. We know that there are some things that have already taken into effect. Things like prescription drug relief for seniors. They get like a $250 rebate. No more discrimination against children who have pre-existing conditions. No more dropping someone's insurance because they became ill. Preventive care is now part of the law, where mammograms, immunizations, annual checkups, those types of things are all part of healthcare reform. And another exciting component is around adults around 26 years old. They can still stay on their parents' health insurance plans. Whereas before, quite often, they had to roll off. Now they can stay on their parents' plan, whether they're married or not, until they're 26. So that's another way of expanding health insurance. And the last part that I think is really important is that the plan requires the strengthening of community clinics. Now, grassroots organizations are very much connected to other organizations, and community clinics are one of them. So I would really encourage grassroots organizations to get connected to community clinics because they're going to play a really big role around healthcare reform and service provision. Now, the health benefit exchange is really important. Like I said, the health benefit exchange is responsible for implementing health reform in California. And that body consists of 5 people who have already been appointed. And I'm going to give you the website where you can find out who these people are, how often they meet, and so on. But in any case, the job of the health benefit exchange is to become a marketplace for health insurance. And their job is to search out what are the best health insurance companies that are going to provide the best services, the best benefits for Californians who are going to be looking for insurance. And so their job is to make sure that everybody has access to quality, affordable health insurance. So they're going to be trying to not only connect with the insurance companies, but also get the best value for Californians who are going to be using the exchange to search for what's the best insurance plan for my family. And so I think the other thing is that the way the act is designed is that families are going to be able to shop online for their health insurance. So it's really going to be exciting that families can do this in the comfort of their own homes. The challenge with that is that for those who don't have access to computers and those types of things, and that's been that'll be provided for as well. And I'll talk a little bit about that in a minute. So I think it's important also for grassroots organizations to know who really will have access to this health benefit exchange. And the answer to that is everyone. Anyone who wants to purchase insurance, for the most part, will have access to the health benefit exchange. And sometimes people are going to have better health insurance through their employer, and that's okay, and they can keep that insurance. It's those who don't have insurance that will want to access the health benefit exchange. And so families and individuals, small businesses, children from low-income families are going to be eligible. They're going to remain eligible for Medi-Cal. Kids that are eligible for the California Children's Health Initiatives, Healthy Families in California, they will remain having access to that program. Families who are still in poverty, they're 400% of federal poverty level, that's like $80,000 for a family of four, something like that. They will also be able to access the health benefit exchange to get insurance. They will also be able to access subsidies that are being provided by the federal government through the health benefit exchange. And so it's going to be a wonderful opportunity for families that right now are having to choose between, do I pay my mortgage or do I pay my health insurance? So it's really a great opportunity for them to be able to access the health benefit exchange and find the insurance that works for their family. And hopefully have a subsidy that also will be able to be applied. And also families that are above that, the 400% of federal poverty level, they also can access the health benefit exchange. However, they aren't going to be eligible for subsidies, but they will be able to get better value through the health benefit exchange. So that's really an exciting opportunity. Now, the implications, what's really important for grassroots organizations, and like I said, is that, and I don't like this term, but hard to reach populations. I mean, quite often we know how to reach populations, but people don't know that we know how to reach populations. The law now says that we know that we're going to be reaching out to racial and ethnic communities that have no or limited English language proficiency. So the state law says that you have to be able to provide this information and services to families in a culturally and linguistically appropriate manner. That's incredibly important, and in the prevalent languages here in California. So oral interpretive services are also going to be available, I think, which is a huge, which is so important to communities that are underserved and monolingual. And so I think it's important for grassroots organizations to really understand that there are going to be these resources available to the families that they're connected to. And in some cases, they'll be able to link them up to others who are providing the service, or maybe they want to provide that service for them. But it's really up to them to stay connected to how is health reform being implemented in California. So it's really important for them to stay on top of that. Now, with regard to health reform, the other essential piece is around public information. So how do we get this information out to families? Again, that's where grassroots organizations, whether it's a faith-based organization, whether it's a community-based organization, they already have these relationships built with families. They know how to communicate with them. They are trusted. So it's really going to be their opportunity to showcase, this is what the law is, this is what your options are, and in some cases we'll be able to say, and let us help you get enrolled in this. So I think it's a wonderful opportunity, and I think that the things that they should be thinking about is playing that role of navigator. We see a lot of that terminology in the Act itself about navigators that are really helping families to really search out what's best for them. Community-based organizations, faith-based organizations should really be thinking about, how do I fit into that navigator role? And so it's really important for them to stay connected, and because they have the history. I mean, they know these communities, and it's important for them. And the only way they're going to be able to serve in that role is if they are part of the policy planning piece. And so it's important for them, like I said, to not only stay connected with various, like the Health Benefit Exchange itself, organizations like ours and others, and I'll give you some websites in a minute. But I think if healthcare reform is going to be successful, And this is a great opportunity for us to really implement it well. Community-based organizations, grassroots organizations have to be part of that process. So just two more things I want to say, and one is that the other piece that I think is important is, and this is down the road, that there's been a lot of discussion, and as part of the Act, health homes. And health homes are where substance abuse, mental health, as well as other chronic illnesses are going to be addressed. So it's really important how we see how health homes, that component is being rolled out in California's healthcare reform implementation. So there's still a whole lot more work to be done. We know the train has left the station, but there are still opportunities for grassroots organizations to participate. I just can't encourage you enough to get people connected with others, get them information that they need, get them connected to websites, and there's lots of different websites that are out there that are providing information on a regular basis so that folks can see how do they plug in. And so I do see that that many grassroots organizations are going to have a role in enrollment, public information, and navigation of the system. So those are the kinds of things that they should be really looking for as they're reading this material and becoming more and more informed about health reform. Again, I just can't say enough. Stay informed. You know, connect with your public health department, see how they're planning for health reform. Get connected with other health providers, community clinics. They're a huge player around health reform. And then, again, think about outreach, enrollment, navigation. Where do you fit there? And to stay informed, I encourage people to go to the California Healthcare Reform website, and that's at healthcare.ca.gov, or the Get Covered California, and that's Get Covered California, so it's getcoveredca.org, or the California Healthcare Foundation. They have chcf.org. So those are really great sites to get connected to, and you can sign up for a newsletter and get information as it comes out on a regular basis. So I wish everyone just tremendous luck, and if there's anything that we can do to be helpful to facilitate that, we would love to do that. It's so important for families to get connected to health insurance, and now's the time. Let's not delay. Let's be a part of this whole process. So thank you.